going to be diving into a topic called sepsis. So now the thing there is everybody knows what sepsis is all about, and I want to quickly say the early recognition of sepsis. How do you recognize sepsis, and what do you do when you recognize sepsis? So the first thing you need to do is to screen all acutely unwell patients for signs of infections and organs dysfunction. How do you do that? That is only when you suspect sepsis. And when you suspect sepsis, it obviously states the patient obviously is unwell, not just unwell, acutely unwell, and not just acutely unwell. They can see that the vital signs, the new score is rising, by the at every given point in time. So, what are the clues that you know that you will see when you suspect sepsis? First of all, the temperature will be above 38 degrees. Also, the heart rate will be above 90 beat per minute. Also, there will be presence of rapid breathing and low urine output. So, apart from that, you can see sometimes it's either the person is extremely cold, or you can see the person also shivering. So, and overall health of the person will be poorly. So, when you identify all this, you are not saying it's sepsis, but you are suspecting sepsis. And because you are suspecting sepsis, the best and first thing to do is to follow these 5 steps to save a life. The first thing you do is to give oxygen, whereby when you notice the oxygen level is very low, you have to immediately give oxygen. So, also, you take blood culture. The reason why you're taking blood culture is to go and check for possible signs of infections. And also, you give IV antibiotics if you're in hospital setting. If the patient is at home and you suspect this, you have to call, obviously, seek for help to get the patient transferred to hospital and get the IVs. Or if it's a patient that's called, giving the consent to be treated at home, in that case, you have to call the hospital at home team to come and get involved. If it's during office hour, you need to let the GP know. The GP will arrange all that for the hospital at home team to come home and treat the patient. But if it's something that is out of office hour, then obviously you have to phone the NHS 24. It depends on what part of the world you are. You have your directory and the contact to call, so they can get the patient transferred to hospital immediately and to commence IV antibiotics, and then also start on IV fluids. Obviously, this patient is looking hydrated, dehydrated. Patient is not drinking, poor urine output. Obviously, that patient needs IV and fluids. Also, you check for lactate. The reason why you are doing so is to get rid of any marker of tissue hypoperfusion. You don't want anything that will obstruct further, create further unwellness for the patient. Already the patient is acutely unwell. And also you need to monitor the urine output. How do you monitor the urine output? You need to put a urine chart in place to record fluid intake and urine output. By so doing, you know how much the patient has taken and how much the patient has brought out. So that's the best way to go about that. And when all this is established, then you start with your ongoing management. So this is where you have to discuss with your team and the treatment plan going forward for such patient. Also, you need to realize the fact that some patients that are in this situation may be acutely unwell to the point that may not be able to give consent. So that is why you need to refer back to their care plan and to their case to see what is written there. If it's something that the POA needs to give consent, or a medical expert needs to come and give a decision that will be valid for the duration of the treatment of the patient. These are the things you need to put into consideration. Having said all this, you need to make sure that the patient is treated in an holistic manner. What I mean by holistic manner, every individual is different. Every illness, it can be same diagnosis for 2, 3 patients, but then the symptoms and then the treatment plan is different for every patient, and that is the reason why you need to treat this person as an individual rather than just someone you're treating, but rather as an individual with a treatment care plan that you need to strictly follow. Having said that, in summary, I would just say the sepsis pathway: number one, recognize sepsis immediately. Then number two, sepsis 6 bundle, that has to be done. That's the point I've just mentioned above. That has to be done within an hour. Then number three, fluid resuscitation and reassessment has to be done within 0 to 3 hours. Then number 4, vasopressor, if needed, has to be done after the fluids have been administered. Number 5, source control as soon as feasible. Number 6, review and ongoing monitoring. So this continues for the duration that the patient remains unwell until the patient becomes well and get ready for discharge. I hope this video makes sense. So if you're still confused about what sepsis is and what to do in case of sepsis and how to identify sepsis, I believe this video had explained what you need to know. Thank you for listening, and I will see you in my next video. Bye.